Hey YouTube, welcome back to the channel. Today is Friday. It is a beautiful day outside. I am not at work today. Obviously, I'm at home. I had a dance performance last night and I decided to take the next day off, and I'm super glad because I'm an old lady now and my bones hurt, okay? Like hurt. Yeah. Also, can we take a moment to just appreciate that? Can you even see this? Look at this. Okay, laundryman, what a ride. What a wild ride. Just ruining all my clothes one outfit at a time. Yeah. Anyway, so today I want to share another taping technique with you guys. You seem to really like those videos, so I'm going to try to do more taping techniques, give you things that you can actually do for yourself or for your patients to make you feel better today. I really love tape. I think that it helps so many people, and it's such a small thing that works so well for so many people. So why not try, okay? So recently I had one of my amazing colleagues show me this tape because I was actually having CMC pain myself, and she showed me how she tapes a lot of her patients to support both that metacarpal joint and the CMC joint of the hand while allowing you to be functional and flexible. So I actually wore it for several days while I was flared up with pain at my CMC joint, and it helped me so much. So I'm going to show you guys how to do that today, okay? All you are going to need are some scissors and whatever brand of sports tape, kinesiology tape that you use. Okay, so this taping strategy is going to be really great for people with CMC arthritis or basal joint arthritis, people who are status post of a basal joint arthroplasty that are trying to wean away from a splint slowly, or people who just are having pain at the joints in the thumb and need a little bit of extra support. It can also be helpful for people who have a lot of MP joint hypermobility. So I'm going to show you kind of what I mean by that. So you can see kind of that joint. See how I can bend that joint backwards a little bit? Some people are going to look really hyperextended there, and some of us just have a little bit of mobility at that joint more than is normal. Our volar plates are a little bit stretched out, or we just, we've kind of, especially those arthritis people, those really late stage CMC arthritis people who are starting to get into that little Z deformity. So we can really help them to get a more functional pinch where they're not hyperextending, or that metacarpal joint isn't slipping so much. If we kind of tape them and put them in the right position, they can actually have a slightly stronger pinch and a more functional pinch too. So it's going to be really good for those people as well. What you're going to need is 2 pieces of tape. It depends on the person's size, right? But I'm going to use like about 2.5 squares for my first piece, and then just over 3 squares for my second piece. It depends on your preference also, and your patient's preference. That's what I like to do. What I'm also going to do is lengthwise trim a little bit off each piece. So I'm just going to cut, maybe, I don't know, like 1/2 inch off or something. I'm not good at measurements, you guys. I don't know. I've not studied a ruler in a long time. And then I'm just going to round my edges of the tape real quick, like that. Same thing for the second piece, just trimming whatever 1/2 inch off. And that shorter piece we're going to actually use first. So let me just round the edges real quick, and then I will show you what to do. Okay, so they should look kind of like this. Okay, so now that we've got our 2 little finished pieces, you're going to start with your short piece first, okay? And you really want to position that person in a nice functional position. So get them halfway between palmar and radial abduction, right? So right about there. Make sure that if you can get them to kind of flex their MP joint just a little bit, that's really helpful because you don't want them collapsing, right? So you want to nice and support them that way. You're going to tear down the middle of your first piece here, that little short piece. And then you want to stick it right kind of in that web space, no tension there because that's going to be irritating for them. but right over the metacarpal joint, right? So right in the middle of that, okay? And then with your two little edge pieces here, you're just literally pulling, sorry, I'm trying to figure out the best way to show you. You just are literally pulling the tape down, okay? So that's my metacarpal joint right here. That's where that bony prominence sticks out, okay? So I'm taping right over the top of that, and then the second piece of this, just like that, okay? So that's your first piece. You can kind of see how that wraps around, and of course smooth it out. Okay, so no real stretch on that piece for me, just really positioning the metacarpal joint into a little bit of flexion. And then for our second piece, same thing, maybe half to 2/3 the way down. And then again, you're coming in with no stretch, and you're gonna put this piece right along that thenar eminence, kind of, right? So right along that part of the palm, you're gonna stick that in there. And then with the next edges, you want to really get a good amount of tension on them. So you're going to really pull that tape back and tape down to the CMC joint, okay? And smooth that out. And then with this piece, again, really nice amount of stretch on there. You're pulling like 50 to 75% stretch probably, and then wrapping up into that CMC joint. And then I have a little bit of extra, which I don't mind. Okay, so you could actually end it a little bit sooner than that, but that's essentially what it looks like. And so if this tape really feels, and you can see, right, like it's still flexible, I can still move through it, but it really just helps support me in that position. So I'm gonna have a really nice functional pinch. Okay, sorry guys, I'm laughing because my camera angles are terrible. Self-filming, yay. But you're gonna have a really nice pinch with that. It's gonna support that metacarpal joint, support the CMC joint. I used this for several days while I was working with my patients. I was doing a lot of manual treatment because we see a lot of patients at our clinic. We're very busy. So I was using this taping method, and within 3 or 4 days, my pain was totally gone. I'm, flared down now. So yeah, I really like this taping method. And again, shout out to my colleague who showed this to me. Thank you so much for giving me this new taping method. I think it would be really helpful for a lot of different patients, or for yourself if you're having thumb pain. So yeah, that's really it. Comment below if you guys have questions. Please like this video, subscribe to the channel so that you don't miss any more hand therapy content. And I hope you guys have a wonderful rest of your day. Thank you so much for watching.